Good morning and thanks for joining us on TVC Breakfast. You can watch us online. We're streaming live on YouTube and you can connect with us on Twitter using the hashtag TVC Breakfast. Let's bring you the news update this hour. Governor Babajide Sanwo-Olu of Lagos State has announced the release of 11 patients from the infectious disease hospital Yaba. He announced this in a tweet where he said they have fully recovered and have tested negative for COVID-19. This brings the total number of people discharged in Nigeria to 20, while 2 deaths were recorded. He thanked frontline health workers and other experts for their service in the bid to curtail the spread of the disease and treat infected persons. The patients have since returned home to their families. Meanwhile, 10 persons have tested positive for coronavirus, bringing the total number of confirmed cases of COVID-19 in Nigeria to 184. Lagos remains the epicenter of the virus in Nigeria with 98 cases. Abuja is a distant second with 38 cases, followed by Osun with 14 and Oyo with 8. Akwa Ibom has 5 cases, while Ogun, Edo and Kaduna have 4 cases each. Bauchi State has 3 cases, while Ekiti and Enugu have 2 cases each. 20 persons have been discharged with 2 deaths recorded. The federal government is stepping up strategies to curb the spread of coronavirus in the country. Minister of Health Osage Hanire says intensification of contact tracing, increasing the number of bed space, collation of the number of ventilators from one facility to where they are needed and plugging the gaps to make the process seamless are some of the measures to curb the spread of the virus in the country.
Ventilators, other things that we are in need of, personal protective equipment, and even things as simple as masks. We have been doing a lot of training. We are going to have treatment centers and isolation centers accredited by experts to make sure that they are safe and that they meet the basic minimum standards of protecting both the healthcare workers and any other persons who come there. But on the whole, we have looked at all the gaps that we have in the health system and tried to plug all of them to the best of the abilities that we have here.
Joining us is Dr. Tunji Funshaw, a physician, cardiologist and chairman, Nigerian National Polio Plus Committee, as well as the past district governor, Rotary International District 9110. Good morning. Thank you for joining us on TVC Breakfast. The COVID-19 pandemic has increased or has gotten to the 1 million mark, and in Nigeria, cases are rising despite measures being put in place by not just the Nigerian government, but governments across the world. How concerning is this for you?
Well, it's quite concerning because, you know, people's lives are at stake. But once you have even just one case of the coronavirus in an environment and the person is not picked up immediately and isolated, you're going to have, no matter what you do, you're going to have an exponential growth in numbers until you peak. What we need to do, and I think the government, you know, in Nigeria and particularly in Lagos State have been very proactive to set in motion facilities that ensure that contacts are traced and they get in touch with them, you know, regularly. You know, I'm a case in point. I came back from South Africa about 2 weeks and a few days ago. We filled the health forms and I was subsequently contacted by staff of NCDC who checks on me every day whilst, you know, I was on voluntary self-isolation. And that has helped to keep the cases down. If you compare us to some other countries, say like South Africa, that did not have any case at the time we started, we're doing pretty well. We're going to see more cases because that's the nature of the pandemic. We're going to see more cases for a while. And the more we test, you know, the more cases we're going to find because there are lots of asymptomatic carriers of the disease. That's just the nature of this pandemic.
But at this moment, the NCDC says it is still tracing, trying to trace some contacts because when you look at the ratio of those that have been tested and those that it says it is still tracing in comparison with the population, a lot of persons have said that the cases might just be that we have so much out there, but because we haven't done as much with regards to testing, that is why we aren't recording as much cases yet, which poses a lot of danger.
Yes, it's inevitable that we'll find ourselves in this situation. I believe every country has found themselves in that situation. It's almost impossible to test all the population. So you must have some criteria that you use in deciding who to test and who not to test. I believe, the DG of NCDC will be in a much better position, to let us know what those criteria are. But I believe that from watch the news conference yesterday, I believe they keep expanding the number of people who require to be tested. The more we test, the more we'll find, because as I said, about 80% of cases are asymptomatic, and they will be in the community. Nobody knows they're there, and they will infect people. And we're seeing that the mode of infection really is not totally fully understood.
Now, some have said that perhaps the measures being put in place in terms of social distancing and self-isolation is not Afrocentric enough and may not really help with tackling this issue, that a more Afrocentric approach is what is needed in Nigeria. What do you make of this stance?
Well, you see, no disease is Afrocentric. That's the thing. This is a pandemic. We need to evolve measures, and I don't think we are, copying hook, line, and sinker what is happening in other parts of the world. We need to appreciate the fact that all of us, individually and collectively, have a responsibility to keep this epidemic, minimized. Every environment can improvise to ensure that the fundamental need is met, which is keep a distance from everybody else, assuming that everybody else around you may have the virus, or that you may have the virus and you may be a risk to other people around you. And it can take different forms, but all of us have to take personal responsibility for safeguarding ourselves and safeguarding the rest of the community.
Now, there is also a line of thoughts where some persons believe that perhaps the youth population on the continent, about 70% of the population of the continent are youth, are made up of youth, and they are believing that this might be a benefit to fighting the virus. Can you hear me?
No, I missed part of that. I can hear you, but I missed part of it. Can you
now,
please repeat?
some section of the society believe that perhaps a section, since 70% of the population on the continent, that's the African continent, is made up of youth who are below the 30-year mark, that could help at fighting the virus.
Well, the virus is no respecter of age. We have seen that in every country in the world. The only difference is that perhaps younger people have much better immunity towards the disease, so they either don't get it, and we have seen that they do quite a lot in the United States, or when they do get it, they don't get severe forms of the disease as a result of immunity. And as a result, they are much more likely to be the people we're talking about who are asymptomatic carriers who can spread the disease. So there's no respect of age. We've had, children being infected. I think, a child, as a matter of fact, was lost to this pandemic in the United States only a few days ago.
All right, so we'll leave the discussion here now, Dr. Tunji Funsho. Thank you so much for speaking with us.